Hi, I'm Dr. Marion Owen, and I'm going to talk to you today about the flu. The flu comes around this time of year. October usually leaves this area around February or March, and so we're starting to see a little bit of flu at the practice. And a lot of times I get questions, is this the flu? Isn't this the flu? Do I need to take medicine for it? So the flu is a very specific virus. It causes a respiratory infection, so it comes on really, really quickly. It causes a cough almost immediately, lots of body aches, pain in your body, your joints, and fever. But predominantly there is always a cough with the flu. Sometimes there'll be a little bit of gastrointestinal distress, but usually the main symptom is going to be cough, not so much upper respiratory, but cough, cough, cough. So when you get hit by an illness that feels like that, sudden fever, body aches, cough, then you've got probably the flu or influenza. And that is the thing that we have a flu shot against. All the other viruses that go around this time of year, cold viruses, gastrointestinal viruses, we don't have a shot for. The cold is actually much more distressing to many people than the flu. It hits, it lasts, and it's a lot more respiratory. It's upper respiratory, nasal congestion, face hurting, pounding, drainage, hard to sleep at night, but not so many of the systemic symptoms like the fever, the body ache, stuff like that. So that's one way to kind of help you decide, is this the flu or not? With both of them, the most important thing is just to do good symptomatic care, because both of them are caused by viruses. So if you get the flu, the risks after the flu are similar to those after a cold, but slightly higher with the flu, that you might get a pneumonia following behind the damage that the virus does in your lungs. The natural bacteria that are in your respiratory tract might go where your lungs are weak and set up another infection. So after you've been sick for a week or two, you should be seeing your symptoms gradually improving. You might still be coughing, but maybe you're coughing less every day. The cough is drier, your fever should resolve, the fatigue should get better. If suddenly at that point you get worse again, that's a sign that, wow, now I've flipped over into something else. Maybe you need to come in and let us take a look at you. Maybe you're developing a sinus infection on top of the virus, or a pneumonia after the virus has already left your body. But as long as overall your symptoms are getting a little bit better every day, you're moving in the right direction. So if you've been coughing for 3 weeks, but every day your cough's a little bit less, you don't need antibiotics. You just need to deal with your cough. So how do we prevent all of these things from happening to us this time of year? What can we do so that we're not sick all the time? One thing you can do is get a flu shot. Some of my patients choose to get a flu shot, some choose not to. I don't have a strong preference either way, unless you have an underlying risk for your immune system. If you're over 65, if you have asthma, if you're caring for someone who has those conditions, if you have an immune system deficiency, or you care for someone with one of those are the people who I say, go ahead and get that flu shot. Those of you who are basically healthy, you can afford to take a week off of work if you should get sick, and you aren't upset too much by being sick. If you choose not to take the flu shot, that's not, to me, a big deal, because you're not at high risk of any complications from the flu. It's the weaker populations, babies, infants, older people, that are more at risk. And so if you're caring for them, you might want to get the flu shot to protect them. So my personal approach to the flu is to try and prevent myself from getting it in the first place. I eat a very bright, colorful diet, as fresh as possible, many colors every day, because all those hidden nutrients in those blues and reds and yellows that we get from naturally colored foods boost the immune system in lots of ways that we don't even understand yet. I encourage people to get regular exercise every day. Get outside, open your lungs up, breathe fresh air, get exposed to the sunshine. That has been shown to decrease any infection and also to improve your immune system response if you were to get an infection. I encourage everyone to take vitamin D all the time, but certainly through cold and flu season. And most people can do 2,000 international units a day of vitamin D3, which is called cholecalciferol, every day, and your levels will not get too high. That includes infants as well as old people, all the way through. That's a very safe dose range. If you're not sure what your dose should be, we can always check your vitamin D level at the office. Also, there's a nutrient called N-acetylcysteine, and I'll write that down underneath the video so you can find it. And there was a great study on that 600 milligrams twice a day in an adult will not prevent you from getting an infection, but it will prevent you from noticing the infection. So it helps you fight off viruses, especially respiratory ones that are around this time of year, the colds, the flu, the coughs, these sorts of things. It helps you fight them off as they start to take hold in you. So you need to be taking that before you get sick. Now, should you get sick, we'll encourage you to take that if you're not already taking it, but it certainly works better if you take it beforehand. So starting now and until spring really hits, you can go ahead and add that to your regimen. It's very safe. Most people tolerate it really well. If you start taking it, you notice a problem, give us a call at the office and we'll troubleshoot that with you. And then most importantly for immune system care is you get plenty of rest, plenty of sleep, that you give yourself room, like when you start to feel ill, just go ahead and take the day off. Rest, have some good chicken noodle soup, and let yourself heal rather than pushing through, because it's when you push hard, when you're starting to be sick, rather than taking it easy like you should, that's when you're going to get more sick. So, when the universe says you're sick, just go home, get in bed, take the day off, you'll feel better tomorrow. I'm also going to attach to this note a really great immune boosting soup that you can prepare and keep in your freezer, a nice herbal tea, and then also a cough syrup that you can make ahead and keep through cold and flu season that's safe for children and adults, anyone over 1 year, because it's got honey in it, so you wouldn't want to give it to an infant. But anyone else, it's a great cough remedy. It works as well as anything else we've got. And it's nice because you make it yourself, so it feels extra good. So we'll attach all those recipes below for you this month. Wishing you good health. Let us know if there's anything we can do to help you.